tuberculosis, TB vaccines' efficacy and effectiveness against COVID-19 is to be studied by Vietnam. Ralph Wandolph Empire from Hanoi, Vietnam reports. Hello, Ralph.
Hi there, Alma. Happy Wednesday.
Happy Wednesday, Ralph.
Right. That's right, Alma. My news today is about tuberculosis vaccine, which Vietnam is going to study to combat COVID-19. Up to 800 Vietnamese frontline healthcare workers have agreed to take part in a clinical trial designed to test the effectiveness of a tuberculosis vaccine against COVID-19. The participants will be given at random a dose of Bacille Calmette-Guerin, or BCG vaccine, which was developed 100 years ago to combat tuberculosis. This is to confirm reports suggesting the vaccine might provide protection against the worst effects of the novel strain of coronavirus. And as we know, the entire world is desperate for a treatment method against the unprecedented pandemic. Now, this plan by Vietnamese health authorities was put in motion after a U.S. study proposed there might be a meaningful correlation between a country's COVID-19 caseload and death rate and whether the country has conducted universal BCG childhood vaccinations. The researchers said in a statement, and I quote, "We found that countries without universal policies of BCG vaccination, such as Italy, the Netherlands, and the United States, have been more severely affected compared to countries with universal and long-standing BCG policies," unquote. Vietnam's Ministry of Health has commissioned the National Lung Hospital and the National Institute of Hygiene and Epidemiology to carry out the research into the caseload correlation within the context of Vietnam, where the vaccine is universally available and mandatory. Professor Nguyen, the director of Vietnam National Lung Hospital, said that the hospital has submitted an outline of the plan to the Ministry of Health pending approval. Now, the hypothesis is that BCG vaccine, and I quote, is not working specifically to prevent infections of tuberculosis, flu, or COVID-19, unquote, but it has a harmonizing effect that can direct the immune system to respond at the right level to SARS-CoV-2. The director said, or told Vietnam news agency. He cited the acute case of the 43-year-old British pilot currently undergoing treatment in Vietnam for COVID-19, saying that while the patient was a perfectly healthy male, his condition had deteriorated dangerously and unpredictably due to his own body's defense mechanisms' overreaction to the coronavirus. He was referring to earlier reports in which the country's leading doctors in the field, who have been watching over his health condition via telehealth format, confirmed that the amount of cytokine that the patient's immune system secreted to combat the virus was too much, causing damage to his own internal organs and functions in a phenomenon known as a cytokine storm. This is quite interesting, Alma. By the way, cytokine is a small protein produced by cells in the nervous and immune systems that affects what happens between cells. Now, what about cytokine storm? It's a severe immune reaction in which the body releases too many cytokines into the blood too quickly. Cytokines play an important role in normal immune responses, but having a large amount of them released in the body all at once can be harmful. Now, moving on, the professor emphasized that the hypothesis remains purely observational and confirmation can be obtained via clinical trials. He said that the plan might be undertaken in two directions. First, it could be a clinical trial with the involvement of Vietnam, Cambodia, and France, designed to see whether the BCG vaccine could help protect high-risk health workers against COVID-19. 800 Vietnamese health workers, together with 400 from Cambodia and 1,000 from France, will be participating in this plan if it goes through. The participating doctors and nurses are mostly from the National Hospital for Tropical Diseases in Hanoi and the Ho Chi Minh City Hospital for Tropical Diseases, where many of the COVID-19 patients reported in Vietnam have been or are being treated. Now, secondly, health experts could just conduct an evaluation on the pool of COVID-19 patients reported in Vietnam and compare the conditions between those who have been vaccinated with BCG and those who haven't. The immunized group is supposed to have quicker recoveries and fewer critical cases than in non-immunized group. On the other hand, the Vice Director of the Administration of Science, Technology, and Training under the Ministry of Health stressed that all medical studies involving humans must be reviewed and approved by the ministry's ethics committee. The BCG vaccine has been included in Vietnam's National Expanded Program of Immunization since 1985. Vietnam is currently capable of producing the vaccine domestically and is providing it for free under the immunization program for all 1-year-olds. 6 countries in the world are reportedly conducting the trial that includes Australia and the Netherlands. Professor Nguyen, however, cautioned that public not to act unwisely on the fear and inject BCG on their own without professional supervision. I quote, "Even if the study is underway, the vaccines must not be given indiscriminately to adults. Japan has seen cases of adolescents suffering from complications after being given a dose of BCG vaccine in an attempt to ward off COVID-19. He warned, adding that in Vietnam, BCG vaccine is recommended only for 1-month-old to 1-year-old babies. Repeat shots are actually recommended against, especially in adults," he said. Total reliance on the vaccine while failing to observe social distancing and proper hygiene measures like wearing masks and frequently washing hands would lead to a worsening outbreak situation, Professor Nguyen said. The World Health Organization at the moment is saying that there has not been sufficient evidence proving that BCG vaccine can lower novel coronavirus infections, morbidity, or the severity of the disease. Alma?
Ralph, I'll see you soon. And that vaccine is indeed interesting. We'll see the results later. Thank you so much, Ralph. Keep safe, stay healthy as always.
My pleasure, Alma. This is Ralph Randolph, and by reporting live from Hanoi, we live in interesting times.